that most children learn how to brush their teeth by themselves as a punishment. Brush your teeth and go to bed. You're being punished. And if we change this to a enjoyable experience with the parents, if you behave and get ready for bed, we'll brush our teeth together and read a book. And can you see the difference in how somebody might pick up the underlying message between those two approaches? And so if you start with a small child on a little stool and an adult, and they have their little toothbrush and you have your toothbrush, and you brush your teeth, they brush their teeth, and then they check your teeth with your toothbrush and you check their teeth with their toothbrush. And within a very short period of time, they will brush their teeth, the pencil line, the important part of the tooth, better than 90% of the rest of the world. And they could eliminate 90 to 98% of all future dental disease just by that one skill set. But if the parent doesn't know how to brush, or what they're trying to do, or how to evaluate, it's like an illiterate parent teaching their young child early reading skills. It just doesn't happen. And also, the parent has to understand that the disease is communicable. It's transferred from the parent to the child, most likely. And so the parent has to know how to brush, how to evaluate, and how not to have transferable dental disease, periodontal disease, gum disease, disease of the gasket or the seal around the tooth, and not have bacteria that causes decay and destruction of the tooth inside the teeth. So that's the educational prevention part. The second part is when the child, obviously, you have to understand that sippy bottles with sugar cause rampant decay. It's tragic, but if you can get childs through that one risk factor, when they're 6 years old, their permanent teeth come in. If you seal the permanent teeth, the 4 first molars, at age 6 or 7, it doesn't stop the bacteria inside the teeth. It doesn't stop decay completely. It just slows it way down. And now if you wait until they're 12 or 13 and that they have all of their other permanent teeth in, and now you go through and you obliterate all of the 16 teeth that have holes and cracks that harbor bacteria, caves in like Al-Qaeda in caves in Afghanistan, and you backfill them, there's no place to reseed bacteria. As soon as you take your toothbrush out of your mouth, the bacteria comes out of these holes and these cracks. And if you're an adult and you've had leaky dentistry done, you have the bacteria in your mouth to transfer to your children. The two things, again, are you have to start early with children. You have to understand the concepts of pencil line and shoreline. You have to understand how to evaluate their brushing. You can't cross-contaminate, and you have to intervene and seal and obliterate all these cracks in these holes, these pits and fissures. Just sealing pits and fissures slows stuff down, but it doesn't stop it. So when you go back at 12, you actually take out the sealant. But by sealing the teeth at age 6 or 7, you don't have to traumatize the child with injections or numbing or bad experience. It's very easy for a chairside to do that procedure. And then at age 12, they're much more capable of understanding the concepts and why you're doing it and cooperating. And their mouth is bigger. So those are my two Hawaii vacation $50,000, $100,000 savings tips. Education, understand it's transmittable. Understand that if you establish a neural pattern in a 3 or 4 year old, that child will not be able to not keep their teeth clean the rest of their life. And if you eliminate the holes and the cracks, the pits and the fissures, you physically obliterate them. And by the way, they already go through the enamel into the inside of the tooth. You cut down on the combination of both of those. Those are both 90% eliminations. You put them together, you got a 99% chance of not having a bacterial disease in the mouth. Thank you.